So I just want to thank everyone for actually joining the session today. Like I say, I know a few people haven't been able to make the live session, but we are recording, and Gabriel, you've agreed that we could pop it up onto our YouTube channel so that those that haven't been able to make it to the live session can watch it afterwards. But huge thanks to Gabriel for actually offering to do this session for us today. And without kind of little ado, I'm going to welcome you, Gabriel, and let you introduce yourself and carry on with discussing your PhD on the experience of rural radiographers in Ghana. Sorry, my cat's annoying.
Okay. All right. Thank you so much, Charlotte. Thank you for the opportunity, and thank you everyone for having time to listen to me. My name is Gabriel Gilbert Ashon. I'm a final year PhD student with School of Healthcare, Cardiff University. I had my master's in 2012 at Cardiff University. I did master's in radiography. I've been a radiographer for 14 years. After my master's, I returned to Ghana and I became a clinical lecturer for 5 years. Doing the clinical supervision of students and all that, I was also engaged in classroom lecture work because of the different circumstances within the Ghanaian context. And then finally, I decided to do my PhD, and I mean, it's been successful so far, even though there are challenges, but it's been good. So I'd like to start sharing my screen and talk about my PhD. Okay, all right. So my PhD is rural radiography practice, exploration of experiences of radiographers in Ghana. I used a qualitative single case study with nested units of analysis design. My supervisors are Prof. Jane Hopkinson and Dr. Nicholas Cortia. Now, talking about rural radiography in Ghana, it's very important for us to have a perspective about Ghana. Ghana has 16 regions. My focus of the study was basically on the Ashanti region. As I don't know if you can see the pointer, Central region. I don't know if you can see. Can you see the pointer?
Yeah, we can. Yeah.
Okay, so Ashanti region, Central region, that represents the coastal belt. The Ashanti region represents the middle belt, and then the northern region represents the upper belt of the country. There are basically, when we talk about radiography practice and healthcare in general in Ghana, radiography started almost a century now. It's about 90 years in Ghana. Ghana has 5 teaching hospitals. There are 10 regional hospitals out of the 16. The 6 regions were created not long ago, a couple of years, like 2 years ago or 3 years. Out of the 10 regional hospitals, there are 9 CT scanners in each region, each of the regions. There are 216 district hospitals and a couple of ordinary ones. That's around 145. There's municipal districts, metropolitan districts. There are other health facilities that are operated by the Ghana Health Service. The teaching hospitals are operated or managed by Ministry of Health directly, and there are mission hospitals. There are also private institutions, that's around 281. And there are quasi-government institutions within the Ashanti region. There are about 8 of them. So this is a fair idea of a bit of the healthcare system in Ghana, and then radiography practice regions and centers where you could have radiography practice within the Ghana. Now, let's have the overview of this presentation. First, we have a brief background and introduction, a brief background of rural practice, what rural radiography is, and all that. Just a brief issue of that. We look at the study aims and objectives, the methodology and methods, focusing on the study design. Then we look at the findings of the study. After the findings, there will be a bit of discussion of what the findings were. Then the strengths and limitation of the study, the implications for policy and practice, then a bit of recommendation for future researchers, then the contribution to knowledge. I mean, the main focus for a PhD is to contribute to knowledge, what you are adding to the existing literature, and then we have our conclusion. Why a study about rural radiography practice in Ghana? There are a couple of issues that I've thought about, experiences, personal experiences, and reading wide about rural radiography practice in general globally within international context. The reason for it is one, the knowledge gap that was found, then my personal and professional experience. You attend conferences and you realize that most of your colleagues are not able to attend the conferences. You find out why, and they tell you issues of shortage because they are lone radiographers. They don't get the opportunity to come because when they move, then the hospital is literally dead. And then for career progression and then requirements for academia in Ghana, in order for you to become a full lecturer, there is a need for you to pursue a PhD. And basically, these are the reasons why I opted to do my PhD. Now let's look at the background and introduction. A bit of explanation of what rural health is. I mean, there are so many definitions of what rural practice is. Some call it rural health. You can call it rural medicine. For the purpose of this presentation, I would be interchanging it. I could call it rural practice. I could call it rural health or rural medicine. It's basically an interdisciplinary study of health and healthcare delivery in rural environments. It's been indicated that there are no international standards in defining it. I mean, trying to define what rurality is or remoteness of an environment is, it's quite ambiguous, and the standards vary within different countries. So my definition of rurality within an African or Sub-Saharan Africa or within a Ghanaian context is different from defining it in Australia or UK, Scotland, or any other place. Now, however, there are approaches that are used in trying to get a clear definition of what rurality is. It's based on population-based factors and geography-based factors. I'll explain that as we go on. Now, the methodology used for classifying rural areas involves population, the population density, the distance from urban center to the rural. So talking about the number of mileage of drive, like you're going to drive. Within the Ghanaian context, we use kilometers, but in the UK context, it's miles. So probably the definition could be 170 miles away from urban center. And then the settlement patterns, there are irregular structures and all that, labor market influence, that talks about GDP and all this economic stuff. And then postal codes within the African settings. Now, generally, it's been indicated that rural areas are deprived areas within various regions, particularly within developing countries. And it's been it's an issue that has been indicated by most Ministry of Health in Ghana, other places, but the people that reiterated it severally was the Ministry of Health Uganda in 2005. Now, rural radiography, it's somewhat not well explored topic in it's within the African, it's under research within the Sub-Saharan Africa, but within the international research, you can see a lot that there are so many papers about rural radiography practice in Australia and some parts of UK. But then within the Sub-Saharan Africa, it's limited. You see one in Nigeria and Tanzania and a couple of them, yes. But there's none in Ghana. Now, radiography practice in Ghana is not very known. It's an area that is not known at all. It's not been visited. However, radiographers are in high demand, but essentially it's unfortunately low within rural areas. There are studies to suggest that 65% of the Ghana's country population live within rural areas. Out of that, it's just about 32.11% of the health workforce, not just radiography, but nurses, other allied health professionals, medical officers. Just 32.11% of them are living or working within rural areas. Now, the issue of access to healthcare within many rural areas due to unavailability of resources. Then the distance, as I indicated, the travel distance, and then issues of transportation, bad road network, and all that. It's something that also caught my attention, and it's something that has to do with rural radiography. Now, globally, rural radiographers face challenges when providing routine radiographic services, irrespective of where you find yourself. There are so many challenges. Even within the UK, it's been suggested that most radiographers do not want to accept rural postings, and I bet when we try to sample the opinions of some of the students, it would not be surprising to see some of them refusing rural postings. It's been an issue that is there for a very long time, and some of the issues that comes out is very important in trying to sort of set an interventional measure to attract, to motivate, and then to retain people in rural areas. Now, Ghanaian rural radiographers are indicated to work with they work with limited imaging equipment, because most rural areas there are lack of equipment and the other modalities because of issues of finances and all that. And there's no radiologists on site because there's acute shortage of radiologists in Ghana as well. So to date, rural radiography has not received much attention. They've just little attention. Now, so it's another reason why it is justifiable to conduct a study to explore the experiences and practice of Ghana rural radiographers, and this will help us to determine how the findings could impact on the working environment, delivery of quality service to patients within the rural areas. Now, to achieve this there were 6 main objectives that I tried to look at. First of all, to map out the contextual factors that has to do with workforce within rural, issues that popped up during my literature search, equipment, IT, population that are served. We look at social cultural issues, economic, geographical issues to rural radiography practice in Ghana. And then more importantly, to establish reasons why Ghanaian rural radiographers remain in their role, and also to determine rural radiographers' understanding of their actual extent of their current roles in terms of their formal scope of practice, whether or not the scope of practice, and then whether they are practicing beyond their scope or not. And then also, something came up, my screen. Okay, sorry. Okay, yeah. Now also to look at occupational health and safety issues amongst Ghanaian rural radiographers within the rural setting, and also to identify the challenges and barriers that has been indicated globally. We want to look at the Ghanaian context about issues of challenges of their practice, and then the major objective is to integrate the research findings into practice by establishing recommendations to develop a nationally recognized framework for rural radiography practice to establish in education and in the practice of rural radiography. Now, in order for us to answer the research questions, there is a need for you to look at the best method or the best approach, the best study design. And there are so many authors, Silverman, Christensen, so many authors have made an indication that as a researcher, there's a need for you to be informed by the methodology that you do based on the study objectives, what research questions you need to answer. And looking at the objective of my objective of the study, there was a need for me to get information. It's a gray area. It's an area that has not been explored. So there was a need for me to look at so many areas of getting what a reality is in order for me to establish what the true experience and then the practices of rural radiography practices within the rural context in Ghana. So I focused on constructivists. I mean, grounded theory could have been used, phenomenology could have been used, looking at the philosophy aspects. But then I looked at social constructivism. When constructivists I've made an indication that in order for you to develop an understanding is based on individual experience and by interacting with a specific environment. And so within this context, it is justifiable to use constructivist approach in soliciting and getting an understanding of rural radiography practice within the Ghanaian context. Now, the social constructivism philosophy was adopted and using a qualitative case study approach. This permits or it allows you to consider both social structures as well as people. And now, in an attempt to understand what the reality is as constructed by an individual group of people within their working environment, there is a need for you to interact with the situation and the condition. So for that purpose, I adopted case study approach one, because case study allows you to use multiple sources of in generating data. So there was interview, there was observation, and then documentary review. You could review documents relating to the rural radiography practice, and then reflective diary of the researcher. So as you go about your reflections and everything contributes as a source of data. Now, from an epistemological viewpoint, social constructivism approaches to research are based on a research paradigm that draws extensively from your personal knowledge. My personal knowledge has been a radiographer, and then my subjective of experience, and then the subjective of experience of the study participant. That's in this context, the rural radiographers in Ghana, and there are studies that backs this claim. Now, as I indicated earlier, this study used a qualitative single case study with nested units of analysis design. Sites and participants were selected purposefully to ensure maximum variation of the rural settings across the country. That's why I indicated by saying that I focus on the upper belt, middle belt, and the lower belt. Now, however, I use snowball sampling technique in order to enhance or get the maximum number of participants. So I reach out to one person, and the one person suggests to other people, and then once they show their consent, they give their consent, then we go on and interview them. Now, as I indicated, data was collected through these modes, that semi-structured interview, observation, and then documentary review. And then the data was analyzed thematically with data integration at the analytics stage. I'll explain as we go on. Now, data collection, the interview, I did a face-to-face, that's one-to-one semi-structured interview. And as I indicated, participants were selected purposefully. Snowball sampling technique was also employed to expand the number of participants. And then their consent were sorted and audio recorded. Observation, the participants, I employed participant and non-participants observation. The participants were observed, that rural radiographers were observed during their practice. So during their day shift, it starts at 8 a.m. to 3 p.m. So I monitored them and I was observing them, taking notes and all that. Now, in the observation, in order for us to be able to have a sort of protocol for observing, so that be all over the place, there are specific things that you focus on. I used Spradley's 1984 method of people, places, and events formats during the observation by when I was shadowing the participants. Now, documentary review was official documents that were relevant, that were available, because to be honest with you, I realized that there was a difficulty getting documents specific to rural radiography practice in Ghana. The only source of data that I got was mainly official letters from Ghana Health Service and correspondence from Ghana Society of Radiographers and MOH that is sought to address some issue of shortage of radiographers within the country. And then the review of my documents and observations supported the data generated, as I indicated, and then my reflective diary, and that I did. Now, as I did, after collecting the data, I use NVivo thematic analysis, using NVivo to arrange to group the data and all that. I sort of did a transcription, verbatim transcription of of the audio recording. I listened to it severally, and then I listened to it whilst typing, and it was a really, really, really difficult process. You go back and forth, you read, you pause, you go. It's a very bitter experience, but it's worth it, to be honest. After that, I employed Brown and Clark 6-step process in data analysis. I did that for all the data sources for semi-structured interview for the observation as well as the documentary review. So that's familiarization. You familiarize yourself with the data, you generate initial codes, and then you search for patterns. Then you get your themes, you develop several themes, you have to review the themes, you define and name the themes, and then now you produce your report. So after that, after the analysis was done using, as I indicated, the interviews and all the other sources of data, there were 6 major themes that were generated. That is motivations to rural practice experiences, challenges in rural radiography practice, impact of the challenges in rural radiography practice, education and training, and policy and planning. But then after everything, when when you get to a discussion, there are many authors that have suggested that there are different styles in discussing your findings. There are 2 ways you can do it. You can decide to pick on each of the things and discuss them, or you'll be able to group them again before you discuss. So there can be major findings and minor findings. So your discussing session could be a major findings and minor findings. But in my case, um, I would like to talk briefly about the findings. Then I later merged them to get 3 overarching broad areas that I focused my findings on. Now, the first, the motivation to rural practice, the study found 2 reasons. Like there's voluntary reasons and involuntary reasons. Why do you accept rural postings? One, some indicated for the voluntary reason, professional status, the autonomy of practice, because some felt when they are in rural practice, they will be able to control things by themselves. They are going to be their own bosses. So it was motivation enough for them. Some indicated there were personal reasons, and looking at some of the interview transcripts, a few of the participants indicated that they had an experience in a rural setting. One indicated that the uncle was in rural setting and there was no radiographer to assist them, so they had to travel several miles and it complicated the issue. And later they lost that uncle, so it was motivating enough for him to say, "Look, when I'm done with my school, I would like to work in rural area," because so that's his reason. Some also said economic experience because they felt living in rural area it's economical, the cost of living is low and all that. Some also wanted a new challenge. Others want to prevent unauthorized practice, that's quacks. Some also want to experience and feel the rural environment. Now the involuntary ones are compulsory postings. People felt they were posted compulsorily because of shortage. You do not have say. You are just posted there, and the reason was that within the Ghanaian context, the government of Ghana sponsors you, and then they will be able to they bond you to serve them for a number of years, 3 or 5 years. So you are just posted there. And then others also indicated for marital reasons, because one indicated the husband was a missionary, so she was forced to go there by virtue of the husband. Now, the second thing to spoke about the rural experience. Now, there are living conditions and working conditions. With the living condition aspect, the standard cost of living, people spoke about it. There were sort of mixed feelings for some people because they felt things as they anticipated were not as they thought. Others also felt the cost of living was okay for them. There were social cultural issues. Some were not okay with their culture because they've no experience, not been in rural area before. Some also indicated there was lack of social amenities. There was no source of entertainment and all that. And then with the working condition, the workforce, the issue of shortage, there are no specialized practitioners within rural settings, and you end up doing a lot of things. Scope of practice was an issue. I'll talk about that. Occupational health and safety issues, and then radiographic modalities, and then equipment within rural settings. There's only conventional within those rural settings. Now, these are the challenges. Now, there are personal challenges and institutional challenges. Now, the distinction is now the personal challenges. Others felt family ties. You are very far away. You need to travel. Looking at the road network, others told me they need like 19 hours of drive. It's like traveling from Scotland to Cardiff before you get to see your family. So it was really stressful for them. That's distance and proximity issues. And then others also felt language barrier because those in the south have a different local dialects. And when you go out there, they have so many different dialects. So it becomes a challenge communicating effectively. Others also said there's no career progression. You lack CPD opportunities. You are just there. You don't get opportunity because sometimes there are so many issues that came up that are really revealing, because one person indicated that actually a number of them, about 2-3 people indicated that sometimes when you want to attend a CPD, your managers would tell you to get a replacement. And you wonder how you, an employee, get a replacement for yourself in order to get an opportunity to go. And it's a requirement for you to have a CPD in order for you to progress as a professional, even to renew your PIN. So it becomes a challenge for them. Now, practice limitation, there are so many things that they studied as a radiographer. You are special examination and all that, because of lack of other modalities like CT scan, fluoroscopy and all that. You tend to do just conventional, and you tend to lose your skills. Now, institutional challenges, there are discrimination against radiographers. They made an indication that other professionals, such as the medical officers, are given free accommodation, but then with the radiographers, they are not given. They also made an indication that with respect to CPD programs and all that, the doctors are allowed to go, but radiographers are not allowed. There's academic isolation. There are a lot of new trends that comes that they are not aware of, like interventional radiography. When you go to the urban areas in Ghana, radiographers are now moving into that. They are limited to that, and there are a lot of political influences, because sometimes the politicians will determine which equipment should come there and all that, and they have equipment issues. Some of the equipment are obsolete. They need new equipment. They break down often and all that. The maintenance culture is very bad. The issue of shortage of staff was reiterated severally by almost all the participants interviewed. Now there's IT connectivity issue. Internet is really bad, very poor internet, and then there is persistent power outages. There are electricity issues. Sometimes the current goes and there's power fluctuation and all that. And then there's shortage of radiographic consumables. There's shortage of X-ray envelopes. Sometimes sanitizers and all that. They are shortage within the rural settings. There's no quality control. There's no quality management. There's no quality assurance. It's very poor. That was what was found, which is quite disturbing. Now, the impact of these challenges, now there's lack of attraction. Because of these challenges, when you tell, they communicate with their other colleagues in the urban areas, they refuse postings. And those already are there, they are demotivated due to the discrimination. They are not satisfied with their job. There's low patient throughput, because even if you have 20 patients, because of the equipment state, and a shortage of consumables and stuff, it makes work really, really, really slow for them. Patients get so tired. The radiographers also get so tired because there's low patient throughput. And then, another impact for being rural practice is lack of the academic and personal progression. And then the skill loss, that's as I indicated, because you tend to be rusted, because you tend to do just conventional and you don't do the other modalities that you had been trained to do. And then there's extended scope of practice, which is also quite challenging, because most of the medical officers depend on you to issue reports, comments on the radiographs that you produce, and there are medical legal transgressions with that. So sometimes they really get uncomfortable working within that. Now, they made an indication for the need for education and training. They said there should be official training for radiography practice. They felt there's a need for extended practice opportunities. There should be staff training programs and workshops. And then they felt there was a need for education training for indigenes, because it was revealed that those who were brought up in the rural areas and they lived there and they went to urban areas to study, they are comfortable coming back because they felt like it's a home for them. So because of that, there was a suggestion that there should be radiography education for indigenes. So indigenes in senior high schools should be encouraged. Those who are doing very well should be motivated to pursue radiography at the university level. And then also there's a need for preparatory training for prospective rural radiographers. So in as much as the radiography practice is general for everybody, those that are posted to rural radiography practice, there should be a sort of preparatory training for them so that they envisage or they anticipate what they are going to see, and when they get there, they will not be demotivated. Now, another thing is the final one is the policy and planning. The need for education policy. They were looking at the curriculum of radiography practice there should be an inclusion of rural radiography practice, because it's an area that has been totally neglected within the Ghanaian context. They spoke about what an ideal radiography practice should be, where there should be everything that an ideal, like there should be other modalities, there should be CPD programs for them, academic opportunities, career progression, and all that. Now, there was a need for them to also to look at the policy to capture ethical and legal frameworks, because the work ethics, because it was indicated that there was no scope of practice for rural radiographers in Ghana, and actually there's no scope of practice for radiography in Ghana. So there's urgent need for policy on respect to that. And then there should also be equipment procurement policy, because the study also found that, it's very interesting. The study found that some of the equipment are wrongly placed, or some of the equipment that were purchased were professionals were not contacted. It was just a politician who decides, because of there's a term that we call it within the Ghana called 10%, because they have their own cards that they get when they purchase equipment. They just don't consider anybody. They just go for their own interest, selfish interest, unquote. Then they purchase just any equipment for them, and it becomes a white elephant, quote unquote, because you don't get to use it. I mean, you defeat the purpose of using the equipment or placing the equipment there. Now, the extended practice and role extension is something that is ongoing, and there is a policy to sort of regularize and then formalize them. They should be trained, and then so that radiographers can venture into reporting and all that. There are studies that have been done regarding that, the opportunities for radiographers to extend their role regarding rural, particular reporting and doing other extended or advanced practices. Now, there's a need for development of framework or policy for rural radiography practice, specifically in Ghana. So these were the things that were found. The study found these things. Now, the things, or all these things, as I indicated, were merged into three broad areas. These were merged based on similarities and association relationship. So the overall three broad areas that were discussed were motivation, attraction, and retention to rural radiography practice in Ghana, experience, challenges, and impact, then intervention and policy formulation for radiography practice in Ghana. So basically, these were the three broad areas that I based my discussion on. Now, most of their findings were confirmatory, but then there are new findings. I'm speaking about contribution to knowledge. The new findings that add to the literature. Some of the findings, as I indicated, were confirmatory because they were previously reported in literature, but then there were other things that were revealed, especially that's lack of official scope of practice for radiography in Ghana. It is specific to within the Ghanaian context. There's no official scope of practice for radiographers in Ghana. It was only indicated that they are giving job description, and most of those ones are based on issues juxtaposed or job description juxtaposed from the UK context to the Ghanaian context. And then there's lack of ethical and legal framework. There is lack of occupational health and safety policies. As I indicated also, lack of quality management protocols in Ghana, workforce strength, numbers of equipment are unknown, because my first objective was to identify or establish the workforce strength of radiographers in Ghana. It's not known because there are so many conflicting reports. Numbers of equipment are not known. There's no documents to actually give that within a Ghanaian context, as compared to other jurisdictions that they have records of equipment and even the workforce distribution. But within a Ghanaian context, sadly, it's unknown. There's no equipment policy. The document review indicated that the equipment policy within different jurisdictions, different countries, but within the Ghanaian context, there's absolutely no equipment policy. So there was a need for that to be looked at. Agents need to look at that. Now, there are no other modalities within the Ghanaian context apart from conventional X-ray and ultrasound within rural areas. There's nothing like CT. There's nothing like any advanced. It's just general X-rays. Some are ultrasound. Unlike other places such as Australia and UK, where you can have other modalities aside conventional, there can be CT in rural area, there can be MRI within rural area, but then within the Ghanaian context, no, it's just conventional. There's no salary structure for rural radiographers. Other jurisdiction focused on rural allowance and other incentives that are sort of captured in the salary structure, but within the Ghana context, there's nothing like that. Whether you are in urban or rural, the same salary applies. But then in other settings, there are other allowances. So the salary structure varies from somebody working in rural and then comparing that to the urban. Now, there are no specific rural radiography policy in Ghana at all. No, absolutely none. But there are with other countries, even some other African countries, they do have, but within the Ghanaian context, there's nothing like that. Now, the strength and limitation of the study. I made an indication, like reading through and everything and trying to reflect on everything. I indicated that the impact of working environment on practice of rural radiographers has been established, and it gives us an understanding of the rural radiography practice in Ghana. But the study cannot overclaim the results to encompass the experience of and practice of all other healthcare, because the practice was only based on radiographers, even though some of the issues, because we are all healthcare workers, some of the issues could be very similar to nurses and other healthcare professionals. Overall, you cannot overclaim the results to encompass all the others, just radiographers. Now, the case study approach permitted the use of multiple sources of data that are syndicated, which gave us a wider awareness of local and national issues, because we were able to, with the documentary, we are able to capture the local issues and then as well as national, even international issues. And then the advantage of using a semi-structured interview, it provides flexibility for study participants to give out whatever they want, like to go beyond, to be able to express themselves, explore the various issues. And then this one was better because questionnaire, you be limited when you use some quantitative study questionnaire, you be limited with what you'll be doing, even though you'll be able to give open-ended questions. But the semi-structured interview was also was good. Now, a major limitation of this study is that I did not include patients. It would have been better to include patients, as it will strengthen the research and explore the views of patients about what they feel the practice of radiography is. Patients could be able to tell what they feel about experiencing or access to radiographic services within rural settings in Ghana, but because of time constraints and resource, and I did not focus on that. And then another limitation is I only focus on 3 regions out of the 16 regions. So it is better future researchers, the recommendation was the future researchers to look at all 16 regions so that we get a balance of whatever might be pertaining, however, these 3 regions that were selected purposively represented the lower belt, middle belt, and upper belt, which have similar working patterns and then environmental, sociocultural issues. Now, the limitation of the study, it's important to note that irrespective of the limitation of the study, the research aim was met through the findings as established in the data. Now, the study took place within 3 regions, and it cannot claim to represent the situation across the country. But however, it could be said to be characteristics of similar conditions in Ghana, as I indicated earlier. Now, the study has implication for policy and practice, yes. The issue of policy and training that were raised with respect to rural growth practice can be managed in Ghana. All these findings will help to address those issues. The challenges that have been revealed also within the Ghanaian context to date, there's no inquiry about experience of radiographers in rural practice, as I indicated, and I keep on reiterating. Among the policy issues that brings to bear, first, it has profound implication for general issues dealing with radiographic scope of practice, very important. The fact that there were no policies and legislation in place both nationally and within the institutional levels within the Ghana, this issue could offer a possible direction when those things are policy are instituted. So this, because of the fact that policies are not in place, it affects the practice and willingness to remain there, because radiographers indicated that there are practice bridges because they report and there are medical legal issues, but because there are no issues now, they do not know what to do, they get confused. So it really affects their willingness to remain. Now, policy and practice structures currently in place, if any, because I didn't know of any, it seems not to have any positive impact on the professional handling of rural radiography practice in Ghana. So there's urgent need for a policy and interventional strategies in place to address the issue of rural radiography practice in Ghana. There's need for urgent policy and practice framework to offer direction to professionals in order for the radiographers to operate efficiently to benefit the patient and the community at large. Now, the study has clinical implication. The findings suggest a need to address the issue of scope of practice bridges, as reporting by radiographers whose competence could not be established, because they were reporting, but their competency could not be established. So there are potential adverse medical outcomes, such as wrong reporting, misdiagnosis, and which could result in preventable injuries or even death, because a radiographer could miss out a potential TB chest X-ray, and you might call it normal, and then it could obviously affect the patient because of misdiagnosis. Now, the introduction of radiographer extended roles and additional responsibility has medical legal implications. So there's a need for a policy to check that. Now, because those rural radiographers are responsible for their actions and whatever they decide to do within the rural settings, whether or not they are doing it to help, there are implications to that. So the policies and framework would offer motivation and improve job satisfaction, and is therefore promotes efficiency and quality of service by these radiographers. Now, recommendation. As I indicated, future researchers should cover the 16 regions. There should be periodic repeats of this study to identify whether or not there are changes with the current findings, and also to determine if the recommendation from the findings have been put to practice. So what the recommendations that I'm giving now, in the next, say, 5 years' time, a similar study could be conducted to identify whether the findings are similar or there are any changes with the recommendation and everything that this study found. I indicated also that quantitative approach could be employed to explore or involve all radiographers, both in urban and rural, so that in case we want to establish whether or not they want to accept rural postings, if our focus is on that, then quantitative research could be done so that we sample all the opinions of possibly all radiographers, registered radiographers in Ghana. The study of this finding, more importantly, can be used to guide in reviewing the undergraduate curriculum, as I indicated, and also to draw up a curriculum for postgraduate education or training for rural hydrography practice roles, such as the reporting and other extended roles that are indicated. Future researchers could also conduct studies focusing on equipment, because the study found that there were issues of equipment procurement and then availability of other modalities. It's a major concern for these radiographers, so future studies could look at that. Another area is to it is interesting that future studies to focus on the workforce and radiographic equipment distribution, so that we are able to get, I mean, it is proper for every country to have a data of their workforce, and then a distribution of their equipment is very important. So in our quest to address the issue of shortage of radiography workforce and the skilled distribution of radiographers and equipment across the country, it's important that these recommendations are crucial, and it could potentially help address the challenges that I've indicated. And then it will streamline regulation and policy for rural practice in Ghana, which would ensure that radiography practice reaches the standard that it ought to. Now, I've indicated a contribution to study, but I'd like to reiterate again the benefit of the study. It's made a unique contribution to the body of knowledge of rural radiography practice, the need for clear pathway for radiography specialization and role extension in Ghana, the need for policy and framework for government in Ghana, particularly in low resource countries as well, because Ghana is a developing country. The other developing countries who can learn from this study, they could juxtapose the findings and the recommendations to fit into their own working environment. As I indicated again, the findings can be used as fundamental guide that can be adapted, modified to meet local needs towards a successful introduction of policy and framework in sub-Saharan Africa, particularly Ghana. And then, because I indicated most of these sub-Saharan African countries, they have similar working patterns, historical and cultural issues, social-cultural issues, and their findings are likely to be really translated and acceptable within those contexts. And then it will also go a long way to help improve quality of service and ensure better patient outcome. In conclusion, the study contains that Ghana needs a policy to address challenges identified in order to motivate, attract, and retain rural radiographers. Ghanaian radiographers need functional professional systems that offer opportunity for career development, particularly gaining exceptional interprofessional skills and comprehensive knowledge in identifying issues like pathology, pattern recognition, so that they'll be able to undertake their extended roles, that role extension issues in the absence of radiologist provision within rural settings. There are various reasons that the study found regarding to motivation, attraction, and retention, and why they remain in their roles. So those could be picked up, and recommendations could be made on this. Recommendation could be accepted. Then the study found interventions and need for policy formulation, as I indicated. And then finally, the study contains that Ghana needs a policy to address the challenges identified in order to motivate, attract, retain radiographers in Ghana. Thank you. Any questions?
Wow, thank you so much, Gabe. I think everyone will agree that this was such an interesting topic for us to learn about, actually, and some of the things that you've covered in your research are so extensive. I think it's just been absolutely fascinating to learn about. I will open it up to anyone else if anyone else has got any questions. If you want to either raise your hand or type in the chat box.
Hi, Gabriel. Thank you very much for that. It was, very, very comprehensive. I'm just thinking, sort of going forward, you've obviously got the findings of your current study. What is your next approach? You've talked about the need to develop a policy. Is that something that you will take forward to the Ghanaian Society of Radiographers, or is that actually a much larger project involving you going to the government and the Department of Health in thinking about a much grander strategy. So what basically, what is your next step now in terms of who will you negotiate to improve rural radiography?
All right, thank you so much. It was quite timely during my data collection. There were issues of shortage of rural radiographers in Ghana. That Ministry of Health, Ghana Ministry of Health and Ghana Health Service were focusing on. And I also contacted the Ghana Society of Radiographers. I interviewed the president, and he was so happy that they even discussed with the director of Ghana Health Service and then the Minister of Health, and they made an indication that it was timely, that they wanted a thorough research about rural radiography practice so that they would be able to be guided by the findings of the study in addressing some of these issues, because the issues of discrimination and then not wanting to go into rural practice because of accommodation. They made an indication of George Orwell's Animal Farm: 2 legs good, 4 legs bad. Doctors were given free accommodation and all that. So it's something that actually the findings will be embraced by all of them, and hopefully it will be accepted, and it would inform practice, and because I mean it's something that they're actually waiting for me to give them my feedback. And also the most important thing to note is I intend to do a publication on various on other things. So I have actually discussed with my supervisors. I have built 6 thematic areas where I intend to do a publication on. So that will go a long way, because once we do a publication in top journals, it also sort of strengthens the findings. It also kind of had a lot of value to your study. So that's the way forward for me. Yes.
Excellent. Thank you, Gabriel. That's brilliant. Thank you.
Lovely. Has anyone else got any other questions?
Hi, Gabriel. How are things?
Hi, Marcel.
How's it going? So would you advise our students that sort of following your route down to sort of following sort of masters and PhDs and furthering their sort of education is a enjoyable route?
Yeah, it is. To be very honest with you, for those of us, the international students, we have a different way of learning and a new experience coming to the UK. And I remember during my masters, the experience really built us. It gives you confidence. It builds your competency. And looking back, I can confidently tell you, I recommend Cardiff University to a lot of people, because I get the opportunity to review works for other people from other universities, and I'm not scared to say Cardiff it's one of the best, because I mean the marking criteria it's very tough, so you need to put out your best. And when you are comparing Cardiff University students to others, I can confidently tell you, I can place myself, I put my neck on the line. We are second to none. And I remember Mansell, I mean, when you score 50+1 in Mansell's coursework, then it means you are excellent. Because Mansell's
I'm not that hard,
is very tough.
I'm not nasty.
Because Mansell taught me during my masters, and I really enjoyed my time. He gave me a lot of experience. He taught me a lot of tricks in doing literature search, in writing up and all that. And I mean, Mansell, I think you should be proud of me, because knowing me from 8 years ago now, the competence level and everything has changed. And thanks to all of you, Mark Linian, Karen Eckloff, all of you, Awel and everybody. I mean, you've really impacted me, and I'm really, really grateful.
I wasn't asking for any great endorsement, Gabriel, but thanks anyway. Like I say, but you would recommend furthering sort of their knowledge and therefore hopefully their careers following similar route to yourself, yeah?
Yeah, precisely. Yes. Good. I think they should be able to. I mean, there are so many things that they could pick up and work on. I mean, radiographers, we need to promote ourselves. We need to make sure we are out there, because most of people in top academia are mostly nursing and physiotherapists and other, but radiographers are also springing up, and there's a need for us to encourage our students to pursue to further heights. It's very important. Yes.
Okay. Thank you for that, Gabriel. That's wise words. Thanks.
Yeah. Thank you.
Thank you, Mansour. I've got a question in the chat. So Jessica's asking, how much do you get to practice radiography while you're doing all of your research?
Okay, so basically, because I'm an international student, you get a steady leave, and in order for you to move and come. So in the UK, for instance, there's a need for you to register with HCPC. Then you'll be able to practice radiography. I mean, you can work 20 hours, and it's always very important for you to get the opportunity to work in different settings so that you just suppose, or you sort of compare what goes on within your setting and what goes on elsewhere. So I mean, you can combine. Everything is based on your planning, and it depends on you actually. Yes, I actually applied for HCPC to get the opportunity to practice radiography in the UK, but because of COVID, it's really delayed, and that's only the limitation. Yes.
Lovely, thank you. I mean, it'd be fantastic, you know, post-COVID, if things start to get back to normal a little bit, you know, it would be great for you to come over and do some practice over in the UK.
Yeah, perfectly. I'm looking forward to it. Yes.
Yeah, brilliant. I'm conscious of time, so has anyone else got any further questions? Okay, if not, Gabriel, would you be happy if anyone thinks of anything afterwards? Maybe if they email it to me and then I forward it to you.
Anytime, yes. Available anytime, yes. So everybody is free to ask any question at any time.
Brilliant.
Yeah, you're more than welcoming. Yes.
Excellent, thank you. So yeah, thank you so much, Gabriel. Like I say, I'm sure I speak for everyone. It was such a fascinating and interesting session, and it's so great to learn about what you're researching. And you know, like I said beforehand, it's always great for us to learn about what's happening, you know, elsewhere rather than just the UK. So thank you so much for doing that presentation for us, and good luck for March, when hopefully you'll be all finished. Martin, have you, sorry, I don't know if you were putting your hand up there.
No, I was trying to do like clap hand sign,
Yeah.
but I couldn't work it.
Thank you so much.
Brilliant.
Thank you.
Thank you.
Thank you. Right, I'll stop the
Thanks,
recording.
Gabriel.